Hello and welcome to the multi-level health information modeling tutorial series. We now continue with part 2 on the background for the complexity in healthcare information systems.
Maybe we are just going digital just because something like flooding the healthcare settings with hardware and the corresponding embedded software without a proper planning on how that's gonna happen. And the fact is that we need to look to the function, the goal of the healthcare system. What the real function of a healthcare system is to improve the outcomes in an individual and in a populational basis. So we want to expand the lifespan of individuals, and we want to expand the life expectancy of populations. We want people to have a better quality of life in all moments of their lives, and we want to decrease infant mortality inside the hospital. We want to reduce the time of hospitalization. We want to reduce hospital mortality, and those are the indicators that we want to improve when we implement a healthcare system. So we need to understand that information technology being implemented in healthcare settings should be understood as a healthcare intervention, the same way that drugs and surgery and diagnostic procedures are understood as healthcare interventions. Implementing information technology is a healthcare is a healthcare intervention, the same way as those others that are more traditional. The fact that if bringing health informatics to the healthcare system is a healthcare intervention, we need to understand that this intervention won't have a huge, significant impact on the improvement of those final outcomes of the healthcare system. There will be a very small effect on those overall indicators. No illusions about it. If you compare to what is really significant to improve the health conditions of a given population, you can compare healthcare information technology with improving income or providing basic sanitation or increasing vaccination coverage for a given population, because those interventions, they do have a huge impact in populational and in individual terms. Nevertheless, based on those promises that have been done by governments and even regional projects, the fact is millions or even billions of dollars, euros, and other currencies have been spent to proceed to this kind of unplanned informatization of healthcare systems, and this type of informatization of healthcare systems is done so probably because there is not too much critical mass in the governmental technical areas. I mean, the policy makers in healthcare or in private healthcare settings, something like the director of the hospital, the decision-making people, those who are in charge of buying hardware and software and deploying them in healthcare settings. Those policy makers, those decision makers, don't have good technical advisory in many cases, and they are not aware of the specificities of software quality in healthcare. And in consequence, medical software is bought, or sometimes it is developed by those projects, and they adopt in this development, or they buy those medical softwares based on the same architecture that is adopted for car rentals, gas stops, or ATMs. And I'm being serious about it here. Nobody is aware about the fact that traditional software architecture has a problem. It doesn't work in healthcare. At this point, after so many years and having so many difficulties to make healthcare systems going digital, at this point we should have had an idea of why that happens. The fact is that using the same architecture that we use for anything else in the human society is not gonna work for healthcare. Why? But before we go further, I need to make a parenthesis here to avoid giving the wrong impression that the only problem that we need to solve is improving software quality and everything will just work fine. Let's imagine here the best quality software possible implemented in a given clinics. Of course, you are thinking about the software that you have developed. But let's imagine the perfect, something that will never be challenged about the quality. And let's multiply that by 1,000. This is the software that we're talking about, and it's there installed at Clinic C. And the patient goes to the Clinic C to have a pre-surgical catheterization, a heart catheterization done. But the pacemaker surgery will be done somewhere else, at hospital age. That, let's say, is provided with a very good, similar software in terms of quality. But those two softwares were developed independently. Which means that the data model that was defined for software C is different from the data model that was defined for software H. But the patient is the same. But we know that even if those two softwares, if they are based on traditional modeling, if they are based on the same software architecture that we use for anything else, and that's what's still happening in healthcare. The fact is that the information that was recorded inside the software C is imprisoned in that software. Same thing to software H. What do I mean with imprisoned? I mean that you can't send an extract of information from software C to software H that will be understood by software H. And that happens because those two data models, they were hard-coded in the software, and so they imprison the context inside the software. But the patient is not imprisoned. The patient is going to those two places, and it will be very important for us to have those informations. And also, let's map those two data models. Sure, you can do that for two systems, but let's think systemically. Let's think about all the systems that are being implemented in other hospitals, in other clinics, in the public healthcare settings, and our patient is going to all those places. The fact is that you just can't map one-to-one all those softwares. This is something that is not possible to be operational. Okay, so let's go back to the question. Why is software engineer that works for all other sectors of the economy, like those that were developed for software C and software H, why does that work for everything else in life and is not effective in health? Why healthcare is different? Healthcare is different because the very nature and the function of the object of healthcare is completely different of all other sectors of economy, because healthcare deals with biological production processes. I mean, processes that were created by nature. I was created by nature. You were created by nature. Your pet was created by nature. The plants are created by nature. The bacteria are created by nature. And that's the object of healthcare. That's the material that is worked inside healthcare. All other economic sectors of the human society deal with industrial production processes, processes that were created by man. Everything: car industry, computer industry, oil industry, any types of services, agriculture, all those things were processes that were created by the man. There is a difference in the very nature of processes created by man and processes created by nature. Those two types of processes are different. Why are they different? First of all, biological processes were created by nature, which means, of course, that I'm saying that they were created by the evolution of species. So we had millions and millions of years. Evolution had millions and millions of years to reach to the complexity of our bodies. And civilization started just dozens of thousands of years ago. But then you can say, okay, so when civilization has millions and millions of years, and then we'll have industrial processes that will be as complex as the biological systems. No, that will not happen, because the function of biological processes is different from the function of industrial processes. Because biological systems, their goal is to guarantee the survival and reproduction of the species. In order to accomplish this goal, they are as complex as necessary. On the other hand, industrial systems, they are as simple as possible, because their function is to maximize profit. But you can say, oh, but the oil industry, the chemical industry, they are very complex industrialized systems. Yes, they are complex, but they will never be more complex than necessary to maximize in order to be able to maximize profit. So you never see something like the tail of a peacock being produced by the oil or by the chemical industry, because that doesn't make sense in the goal of maximizing profit. And this difference is very important, because this is essential for us to understand why healthcare software can't be developed the same way that we develop software for any other industry of the human society.